Which layer of the skin does not contain any blood vessels? Epidermis. What protein makes up the structural foundation of hair and nails? Keratin. Which layer of the skin contains nerve endings, sweat glands, and hair follicles? Dermis. What is the primary function of sebaceous glands? To secrete sebum to lubricate and waterproof the skin. Which cells are responsible for skin pigmentation and protecting against ultraviolet radiation? Melanocytes. The subcutaneous layer is also widely known as hypodermis. What essential nutrient is synthesized by the skin when it is exposed to sunlight? Vitamin D. Which structure is responsible for causing goosebumps by pulling hair follicles upright? Erector pili muscle. What is the innermost growing layer of the epidermis where rapid cell division occurs? Stratum basal. Which type of gland is primarily responsible for body thermoregulation via sweat production? Eccrine sweat gland. Which layer of the epidermis is found only in thick skin such as the palms of the hands and soles of the feet? Stratum lucidum. What type of tissue primarily makes up the hypodermis? Adipose tissue. What is the name of the pale crescent shaped area at the base of the fingernail? Lunula. Which type of skin cancer is the most common but least likely to metastasize or spread? Basal cell carcinoma. Which immune cells reside in the epidermis to help detect and fight foreign pathogens? Langerhans cells. A burn that damages both the epidermis and the upper region of the dermis, causing blisters, is classified as a second-degree burn. Which sensory receptor in the skin is specifically sensitive to light touch and is abundant in hairless skin like fingertips? Meissner's corpuscle. What substance found in sweat gives it an acidic pH between 4 and 6 to inhibit bacterial growth on the skin surface? Acid, mantle lactic acid. Which gland type is found primarily in the armpits and groin, activates during puberty, and releases a thicker sweat that leads to body odor when broken down by bacteria? Apocrine gland. What is the primary pigment responsible for the pinkish or reddish tint seen in fair-skinned individuals? Hemoglobin. What term refers to the process of skin called hardening, flattening, and drying out as they migrate from the deepest layer to the surface? Keratinization. Which structural component of the dermis gives the skin its tensile strength and prevents it from tearing when stretched? Collagen fibers. Modified apocrine glands found in the external ear canal that secrete earwax are known as ceruminous glands. Which layer of the epidermis consists of up to 30 layers of dead, flattened, keratin-packed cells that continuously slough off? Stratum corneum. What occurs during vasoconstriction of dermal blood vessels? Blood vessels narrow to divert warm blood away from the skin surface and conserve heat. Which touch receptor is located deep within the dermis or hypodermis and detects heavy pressure and high frequency vibrations? Pacinian lamellated corpuscles. What specialized structure fastens the epidermis to the dermis, creating the wavy boundary that forms our fingerprints? Dermal papillae. A third-degree burn is characterized by which of the following clinical features? Destruction of the full thickness of the skin, resulting in a charred and leathery appearance with little immediate pain due to destroyed nerve ending. Which yellow to orange dietary pigment can accumulate in the stratum corneum and fatty areas of the hypodermis when consumed in large amounts? Carotene. What is the active growth phase of a hair follicle cycle called? Anagen. What clinical term describes a yellowish tint to the skin and eyes caused by the buildup of bilirubin due to liver malfunction? Jaundice. Which layer of the epidermis is characterized by cells containing dark staining granules that help form a water-resistant lipid barrier? Stratum granulosum. What is the name of the delicate connective tissue sheath that surrounds the root of a hair follicle and provides it with blood flow? Dermal root sheath. Collagen fibers in the dermis tend to run in parallel bundles. Incisions made parallel to these structural lines heal faster and scar less. What are these lines called? Cleavage Langer's lines. What occurs during the catagen phase of the hair growth cycle? The hair follicle shrinks and detaches from its blood supply. Which cells in the epidermis function as touch receptors by closely associating with the sensory nerve ending in the skin? Merkel tactile cells. Which protein molecule binds to water in the extracellular matrix of the dermis, keeping the skin hydrated, plump, and bouncy? Hyaluronic acid. Which type of skin cancer arises from the keratinocytes of the stratum spinosum and can grow rapidly and metastasize if not treated? Squamous cell carcinoma. When checking a mole for potential melanoma, the B in the medical ABCD rule stands for border irregularity. What is the skin's very first cellular response immediately following a cut or deep wound? Blood vessels constrict and platelets form a clot to stop bleeding. What modified sweat glands produce a specialized secretion that forms the primary source of nutrition for newborn mammals? Mammary glands. What is the clinical term used to describe a bluish discoloration of the skin and mucous membranes caused by a lack of oxygen in the blood? Cyanosis. Which specific layer of the dermis is composed of loose areolar connective tissue and features finger-like projections that indent the epidermis? Papillary layer. Which vitamin deficiency leads to a lack of structural collagen production, causing old skin wounds to reopen and gum to bleed? Vitamin C. Which cells inside a hair follicle divide rapidly via mitosis to produce the actual hair shaft? Hair matrix cells. Which touch receptor is specifically adapted to detect continuous deep pressure and the stretching of skin folds? Ruffini ending bulbous corpuscle. What protein molecule gives the dermis its elasticity, allowing skin to snap back into place after being pinched or pulled? Elastin. A complete destruction of the epidermis, dermis, and underlying muscle or bone is classified as fourth degree burn. What standard emergency medicine formula is used to calculate the percentage of total body surface area affected by burns? Rule of nines. What type of cell junctions tightly bind keratinocytes together in the stratum spinosum, giving the layer its characteristic spinny appearance under a microscope? Desmosomes. Thank you for watching and subscribe for more videos.